We appreciate you joining us for another IEA Reporter interview. Today, we're joined by Dr. David Pate, who is the recently retired CEO of the St. Luke's Health System. Dr. Pate and his team have been working with the West Ada School District on revising their safety plan in hopes of achieving the dual goals of protecting the health of students and staff and providing in-person instruction to the greatest extent possible. A highly respected physician and administrator, Dr. Pate has provided valuable perspective on COVID-19 and policy decisions being made by school boards, health districts, and elected officials around the state. He has graciously agreed to share some of that expertise with us today. Dr. Pate, let's start with that balance of keeping school buildings open as well as providing a safe working and learning environment. To what extent can both of those be achieved, and how can it be done?
Well, I think both of those goals can be accomplished. I'm not sure we can continue to do that indefinitely given the way things are going, but certainly up to now, it's been possible to do so. With that said, obviously there are some children that are very high risk or have a family member that's high risk that would be better served being remote. There are some teachers that are high risk and they would be better served being remote. But I think you said it well. I don't make the decision about whether schools are open or not. That's not my decision to make. What my purpose is, okay, whatever your decision is, let me help you make it the safest it can be. And so that's what we're trying to do is, I'm not an educator, but I've talked to enough professional educators that they have told me that there are a lot of children, not every child, but there are a lot of children who don't learn well remotely. There are children who need more in-person attention. There are children with special needs. There are a lot of circumstances where if a child cannot be in the classroom, they are going to suffer from an educational standpoint or any other number of risks. And therefore, I think parents need to decide what is best for their child's particular circumstances. Do they feel like they want to keep their kids home to keep them safe or for any number of reasons? Or do they feel that their child is really going to benefit from in-person education? And as long as that is an offering that the school district wants to make, then what I want to try to do is figure out, okay, how do we keep those students, their families, the teachers, the staff, how do we keep everybody safe? And frankly, in the short time that I've been engaged now, we've made a lot of changes that are making schools safer. Again, we have to look at this all the time because things are changing, and unfortunately, in the community, things are changing for the worse. And as I told the board when I last spoke to them, we could see transmission changes related to the amount of disease in the community, related to co-infections with influenza, which we're expecting. So there's a lot of things. We can't just say, well, it's safe today and think that necessarily means it'll be safe for a month from now. It might be, it may not. We're going to have to watch and look and see.
Right, and change has been kind of the operative word throughout 2020. And one of the things we've seen is that safety plans have varied quite a bit from district to district, and in many cases they've been changed on the fly in various places around the state of Idaho. My question for you is, are there common components to the good safety plans? And a second part would be, would a statewide approach be better than district by district?
Yeah, the first thing I'd like to say, I have reviewed a lot of safety plans or operational plans. And certainly there are some things that tend to be very similar among them, but there's also a lot of differences. And I will say I've never reviewed a plan that I didn't think changes need to be made to it. Some much better than others, but in all fairness, my heavens, the school leaders and the teachers and the principals and everybody. Most of them are not public health experts. Most of them are not doctors. Most of them aren't epidemiologists or virologists or any of these things. So frankly, I've been impressed that the plans are as good as they are, given that this has been put on teachers and principals to come up with. I think it would have been much better if educators and medical professionals had done this together. And certainly I've been invited in a few of those cases to do that. And now West Ada has. The new plan that we've come up with West Ada, and obviously I'm biased because I wrote a lot of it, but I really think it is a cutting edge plan. And here's why I say that. The first thing is, of all the plans I've seen, they are written for school leaders and teachers. And as I told the board last month when I spoke to them, what we really need is a partnership with our parents, because we can't do this without the parents. And we have certainly seen some things going on outside of schools that really make it very hard on schools. We really need parents to work with us. And so one of the novel things about this plan is it's actually written for school leaders, teachers, and parents. And it explains what parents should do. So that's one thing. The second thing is a lot of these plans throw a whole lot of information at people, and you can read them, but you can get lost. You're not going to remember it all. And what we want to do is have people, I just want them to particularly remember the main things. And so what we did in this plan is we tried to use some phrasing over and over and repeat it in the plan, and we highlighted it and said, these are the 3 or 4 things that we really want you to remember out of this. So I think that's a novel approach. Another thing is, I've never seen a plan that explained why. And one of the things is when you're asking people to do things differently, it really helps if they understand, why do I need to do this? Because we are asking people to do more. So if we can explain it and why this is important, I think that helps. So those are just a few features of this plan. We also when I talked to the administrative team, I said, let's just get rid of the color schemes, the categories. I mean, it's just got everybody confused. And frankly, I don't see anytime soon that we're going to be out of whatever you want to call it, red or category 3 or whatever. Let's just write the plan for that. If things get better, and I hope they will, let's amend the plan. But instead of throwing out a lot of stuff about, well, if we're in green, do this, well, we're not seeing green for a long time. So why bother people with that? So we just kind of cut all of that out of the plan. So to answer your question, I think this is a really good plan. It's not perfect, but it's a really good plan. And if a really good plan like this was adopted statewide, then yes, I think that would be helpful. Obviously, having a plan that's not good adopted by the state won't be a good answer. And most of the times, the big things I see that are not good in operating plans that I've seen is, first of all, a lot of times there's a lot of incorrect information about face shields. Face shields have just been a curse to me during this pandemic. They have a place. It's a very limited place. And yet people have really run with this face shield thing, and it is just so dangerous. So that I commonly have to correct that. A lot of the other things about plans is a lot of plans don't deal with, they're really focused on the classroom, but there's a lot of other activities that go on in a classroom. And I very seldom see that they address those other activities.
Yeah, I wanted to follow up on that because that's one of the truisms that you alluded to, and that is that schools and school buildings, schools do not exist in a vacuum. They're part of the greater community. So even in cases where potentially the protocols are being followed in the buildings, sports and extracurricular activities and all kinds of things could be leading to a spread of the virus. So I assume that's a major concern.
It is. So when I've been recently talking with the administration, I said, look, let's think of it as our schools are fortresses. And what we're doing is we're trying to keep the enemy out. And we know the enemy's coming up to our fortress. It's trying to get across the moat. It's trying to penetrate the wall. It's trying to get in here. But we got to keep the fortress strong. And I said, so what my job is to identify what do I think are the threats that could get across the moat, across the bridge, through the gate, into the fortress. And we have a number of those. Every kid that has a mask exemption, that they're penetrating our fortress, they're a potential threat. Every teacher or student that is using face shields incorrectly, it's a threat. And that's a situation where we've let the enemy in to the fortress. And so anytime we're not wearing our masks, particularly at meals, those kind of things. So those are the kinds of things we really focused on is, we're not going to make the fortress impenetrable. It is penetrable, but the key is let's keep on looking at where things are getting in, and let's try to plug those holes or put up a guard or something to help just decrease that. Because remarkably, I have to tell you, when I was thinking about this in the summer, I did not think schools were going to do as well as they did. I thought this was just going to be a disaster. And it's turned out schools are doing, and this is not just in Idaho, this is across the country. Schools are doing way better than I would have predicted. And the reason is that we thought at that time that we did think school transmission level would be less than what's in the community, but we thought it would move with the community transmission. And so if there's more community spread, we figured there'd be more in-person spread, and we haven't seen that. And that's the same with my colleagues across the country. Even in other countries, we haven't seen that. And I think that what we're thinking right now is as to why, because this has been a pleasant surprise. I think that it is because when people are in schools, they are enforcing masks. We all know we're not distancing properly all the time. And I don't know that we ever will, but we ought to do what we can. But the masks seem to be the key difference. And of course, when we look at schools that have had outbreaks, a lot of them was because they did not have a mask requirement, or they just said, well, we'd like to encourage you to wear masks. Well, that doesn't work. Those have been the schools that have had the big problems, but schools that have enforced masks and had universal masks have actually done pretty well.
How possible is it, though, that part of the explanation for that statistical difference is that the data is being underreported, that's not accurate? One of the things we hear quite a bit is that parents, coaches, administrators are discouraging testing so they can keep their buildings open and keep their sports going. How possible is that as one of the answers to your hypothesis?
Well, I can tell you all data is underreported. So whether you're looking at the CDC website, whether you're looking at WHO data, whether you're looking at schools, it's all underreported. I am not naive or disillusioned about that. But I don't need perfect reporting to be able to tell what's going on. And I just need enough reporting. And so, yes, obviously, that's another threat. When parents have a sick child and don't get them tested, that's a potential threat for us. When coaches or students put peer pressure on kids not to get tested if they're sick because they don't want quarantine, that's another threat. So I'm confident there is some of that. However, one of the things I do when I do my walkthroughs, I always do talk to the school nurse to see, hey, what are you seeing? What is your perception of it? And so far, and of course, I've only begun doing my walkthroughs, but so far the nurses think, yeah, there probably is some of that, but we're actually, what a lot of them tell me is they are seeing on the behavior of most, that they are being very careful about this and compliant with it. I have no illusionment that this is across the board. But the other thing is, you can only hide it so long. If take sports, for example. We've seen outbreaks in sports. We've seen clusters in sports because you can't hide it. Yes, you can slow us down in identifying it if you're playing games like that and not getting people tested. But what will happen is, this virus is so contagious that if you're not doing the right things, so if you are carpooling to sports, if you are having after sports parties, get together, whatever, people are going to get infected. And you can hide some of that, but pretty soon the pattern becomes abundantly clear. And we've identified a lot of these sports and activities that have indeed caused clusters, because you can't hide it forever. We will see it. And so I understand there's underreporting. I understand there are people playing games, but I guess the other thing I would say to people is, because people also are concerned, well, there is widespread transmission in schools because the kids are asymptomatic. No. Yes, there are going to be a number of kids who will be asymptomatic, but not all. And you cannot selectively transmit this just to kids that are going to be asymptomatic. It's going to show up. And if there's an outbreak in a school, you cannot hide it. We will see it. It will be absolutely clear, because enough people will be symptomatic. And then when you test the close contacts who are asymptomatic, if they're infected, we'll find positives. And so I understand people are worried about this. It is being underreported, but it's not hindering our ability to assess the situation too much.
What kind of sense do you get as you've done building walkthroughs and talked with educators and administrators and all the people involved from a staffing perspective? Do schools have what they need in terms of, you mentioned nurses, you talked to the nurse. There are a lot of schools that don't have a nurse
Yes.
or have a part-time nurse. Do we have the medical personnel? Do we have the substitute teachers? Do we have the support staff that we need to be able to safely keep schools open?
Yeah, I think it is to some degree variable. I'm not sure all schools are the same.
Sure.
And so I began my walkthroughs, and the first ones I let the school district pick. The next three schools that I'm going to, myself and my partners at Central District Health, we picked the schools. So we're going to go see if this holds up. But the first couple that I went to, yes, they seem to be holding up. They tell me they are doing okay. I think what I have seen is, first of all, while the school nurse that I talked to, and these are amazing people. I mean,
no question.
God bless these school nurses, what they're doing. And as I talked to her, yeah, she's keeping up, but she's keeping up by doing 12, 14, 16-hour days. That's not sustainable. So I do feel confident that she's on top of things. Things aren't falling behind, but we've got to get her help. And so one of the things that I'm doing is I'm reaching out to all the nursing schools, and I'm seeing, are there some nursing students who might want to volunteer and help us with some of the activities that are time consuming that the nurses are doing, but don't require the full nurse skill set, so that we can free the nurses up a little bit. So that's one thing. I'm also checking to see, the governor mobilized the National Guard. Can we avail ourselves of some of those National Guardsmen? Can they help us in some of this work too? So we're looking to see, are there some reinforcements? I think so far they're okay, but they can't keep doing this. The teachers, and I just have to say, I know in my own profession of doctors, I love doctors. I think they do amazing things, but we've got some that I'm not quite proud of. And I'm sure the same thing must be in education. But let me tell you, the teachers that I have come into contact with and talked to, I mean, they're just amazing. First of all, it is clear to me how much they care about these students. And most of them will tell me, yeah, these students, they need me here. They need in-person education. And so I'm extremely impressed by these teachers. One of the schools I went to, Lake Hazel Elementary, I mean, I've been a long time student of leadership, and I believe leadership matters. And this principal, she knows everything that's going on in her school. She knows everyone, everything, and you see it. And I'll tell you what I was amazed by. And again, I've just started, so maybe I won't see this at every school, but we'll see. But I was absolutely blown away with the mask compliance. So this elementary school, which I would imagine of all elementary school kids are the hardest to keep masks on. I think in my whole walkthrough, I think I saw 2 mask violations. Incredible. I expected way more than that. The students seemed to be doing extremely well. They were doing a great job of trying to keep distance. The masks were great. And then all the measures that the teachers and the principal took, the mitigation measures, and we gave them some ideas of some more things that would help further. But I have to tell you, I'm very impressed. And then we went to Sawtooth Middle School. And again, I saw a very engaged principal. I saw a lot of good things there. I saw some issues too. And one of the big challenges appears to be hallways. Kids want to get together during the hallways. The good thing is, at least if you can keep them moving, that's going to help. And that was the situation. We typically saw very good mask compliance in classes, saw a few mask problems in the hallways, but I think these are things we can remedy. But I just want to say a word of praise for principals, for teachers' aides, for everybody working in this. You all are just doing amazing. I'm so proud of you. And sure, we've got issues. Sure, we've got things that we can do to make things better. But this is so extraordinary. I'm extremely proud of you. Now, one of the other things that we saw on the distancing front is that one of the challenges was a lot of these rooms had a single projection screen where the teacher was projecting. Right. And so even though there was actually some unused space in the classroom, they had to bring the desks in closer so that kids could see the screen. So one of the things that I did is I just asked administration, hey, can we get some more screens? I mean, that's what we would do in conference rooms is we just put in more screens and then we can spread out desks. And so I think they're working on that, and that will allow us to get some more distance. And there's some other things that I've seen that we could do to bring some help. We're not going to do the distancing perfectly. And frankly, what we've seen so far, the evidence suggests we don't have to do it perfectly. We just have to make a good effort at it. But the big thing is keeping those masks on, and we're just not seeing a lot of transmission. Where we have seen transmission is schools that were not requiring the mask, or we've seen it in extracurricular activities. That's the other area where we've seen it.
Dr. Pate, let's shift gears just a little bit. We're seeing encouraging reports about vaccines.
Yes.
How effective are they likely to be? And what kind of timeline are we looking at here in Idaho, especially as it relates to educators and students?
So let me tell you, the vaccine information beyond my wildest dream. First of all, safety is of paramount concern. We did have some scares along the way. You always do. But it turned out that the issues that we saw were not related to the vaccine. It was related to underlying medical conditions these people had. So it appears to be a very, very safe vaccine. I'm certainly confident with what I heard. And when the data comes out, I'm going to review the data. But if the data holds up to what people are saying, I'm going to be rolling up my sleeve.
Right, and there are two or three different vaccines that with roughly the same effective rate, right?
That's right. And so safety is one aspect. Then the other is effectiveness is what you're getting at. And what I hoped for, because we never have I mean, we almost never have a vaccine that's 100% effective, and we don't need it to be 100% effective. But I was hoping for 70%. And I thought I mean, if you could just give me my wishes come true, 80%. We now have two vaccines that look like they're 94.5% effective. This is unbelievable. This is so great. And then we have a third vaccine that, I still want to look a little bit closer. I'm not convinced, but apparently one arm of the vaccine was 90%. I'm not ready to hang my hat on that one yet, but we also have a bunch more in the pipeline. But let me tell you, if we have vaccines that are 94.5, 95% effective and safe, this is a game changer.
So what's a realistic timeline then to get those teachers and educators first? I would assume they're maybe behind healthcare workers among the first people to get this, and then students maybe fall a little bit later. What's a realistic timeline?
Yeah, there is going to be a gap between teachers and students. So let me explain. So teachers are going to be in the high priority group, and I'm delighted about that. It is likely that the very first doses of vaccine will be coming to Idaho in December. Not a whole lot, but the first doses, and remember, these vaccines are 2 shots, and typically either 21 or 30 days apart. So I think there will be a number of people, probably first responders, some of the healthcare workers, that will get a shot this month and then complete their series next month. I would not be surprised if we couldn't get vaccine to teachers in January or February. Which would be great. And then same thing, it'll have to be 2 shots. So if you get the vaccine, from the day you get the vaccine, it'll be about 6 weeks till you'll pretty much have your full immune response to that. So that's pretty good. The reason I say kids are going to be later, we never include in vaccine trials children at the beginning. We always do adults first, make sure there aren't problems. So they have been gradually expanding. So they went down to 15. Now some trials have gone down to 12. We're hoping that with the FDA approval, we'll be able to enroll even younger children. And so I think children are going to lag several months, but I see nothing yet that suggests to me that we couldn't have all of our students that are going to get immunized by the summer and ready to go for next school year.
So as we said, that's encouraging. But in the interim, we've got flu season, we've got holidays and travel, which are likely to exacerbate the problem. So as someone who has headed up the largest health system in the state, how concerned are you in this shorter term outlook about the capacity of our medical facilities and staff?
I've never been more concerned. I would say I'm at the level of alarm. I was just at one of the hospitals today, talking with some folks about what's going on there. It's unbelievable. And God bless them. They're doing a lot. They are converting other units to be COVID units to handle it. But hospitals have had to stop doing a lot of the normal things they do so that they can redirect staff and resources to taking care of COVID patients. And that's not good because there are people that need care for other things besides COVID. But we really are at a dangerous point. We already have a hospital on diversion. The Magic Valley Hospital is not being able to take on patients, so they're shipping them to Boise. And, St. Luke's and St. Al's are hanging in there for right now, but both of their models, St. Luke's model shows that they will be at a crisis standpoint later this month. St. Al's shows in January. It's not going to be good. And as you pointed out, a couple of things that aren't in this projection is, what is the impact from Thanksgiving? We just had that. I was absolutely, you would think I would stop getting surprised, but I continue to get surprised. And, the survey is suggesting more than 50% of Americans were planning to travel for Thanksgiving. This is a dangerous time to be traveling. And I believe it from some of the pictures I've seen of airports. This is not going to be good. And Canada had their Thanksgiving in mid-October. And this is exactly what happened in Canada. They had tremendous spread in extended families that got together for the holidays. We're going to see that. So it'll be in about 2 weeks. It's going to be more pressure on our hospitals. At the same time, just as you mentioned, we've already got 2 strains of influenza circulating in Idaho, and we haven't had a lot of disease activity, but typically we do after Thanksgiving. And so we could be dealing with a situation where we just have a convergence of a whole lot of factors. Already, we've got record numbers of COVID cases, and we may have many more with Thanksgiving. Then throw on influenza, and we could be in big trouble. I'm very, very worried about the hospitals.
Well, it hasn't been an easy situation, certainly for anybody, but I would say that accurate information and perspective have been kind of difficult to come by. So we certainly appreciate the fact that you've jumped into the fray here and provided that on a lot of fronts, but in particular when it relates to education. Thank you very much for your work in that area and for joining us today. Appreciate it.
Oh, well, thank you. Thank you. Glad to be with you.